Number one is number one is mechanism of action. I'll start sharing my screen now. And if you can see my screen, just if you can't see the screen, just go to the chat and say I can't see the screen, right? If you want to make a comment, just go to the chat. Somebody is there monitoring the chat at the moment. So, and please kindly mute your mic so that we can enjoy, the class as well. If you can't hear me, go to the chat and just say I can't hear you and all of that. So, so we're going to be talking about mechanism of action and national drug policy. It's becoming a little bit more interesting now because we are moving to, a little bit of the pharmacology more. So, mechanism of action. What is mechanism of action? It actually involves just two things, which is pharmacokinetic and pharmacodynamic. So, but what is pharmacokinetic? It's very, very simple. It's just very, very simple. It means it just means what your body does to the drug, while pharmacodynamics means what the drug does to your body. If you can just know it like that, it becomes a lot more simple. Pharmacokinetic is what your body does to the drugs. Pharmacodynamics is what the drug does to your body. That is, mechanism of action is in two. One, pharmacokinetic, pharmacodynamics. Pharmacokinetic, what my body does to the drugs. Pharmacodynamics, what the drugs does to my body. So we'll start off by talking about pharmacokinetic. Pharmacokinetic refers to the movement of drug within the body, and it consists of just four processes. And we've been able to abbreviate them to HADME. You see, we've been able to abbreviate it to HADME so that you'll be able to recall. Maybe in case of when you are stuck and all of that, you are trying to remember, just know that it is ADME, ADME, which A stands for absorption, distribution, metabolism, and excretion. I know that we've done anatomy and physiology, we've done mechanism of food digestion and all of that. It's just almost the same thing, but it's just that this is drugs basically. So, what is absorption? It's just the process by which the blood enter into the bloodstream, from the site from which it was administered. And yesterday we've already talked about route of drug administration. We've talked about oral route, we've talked about parenteral, which includes IM, IV, intrathecal, and all of that. We've talked about sublingual, buccal, and all of that. We've talked about it yesterday. So absorption is just the process by which the drug enters the bloodstream through the route of its administration. Let's say, for instance, drug that was given intravenously, of course, it's going to enter into the bloodstream a lot faster than a drug that was given orally. So the factors that affect absorption include route of administration. Just like the example I just gave now. If you are giving a drug, by mouth, of course, it's going to take a little time, you know, more than drugs that you are giving intravenously. It's going to go straight into the blood system, into the bloodstream straight away. Or drugs that you are giving as an inhalant. Maybe for example, salbutamol and all, it's going into the lungs and it's going straight into the blood, into the cardiac circulation straight. So it's going to be a lot more faster. And the drug formulation as well. Drug formulation itself, it's another factor. Drug formulation and solubility is another factor. How can the drug dissolve in a liquid solvent? How fast can it dissolve? That's what it means by that solubility. Leave the grammar. So another thing is the process of food or gastric pH. Is it how what is the pH of your stomach at the time? For example, those drugs that we take orally, and is there any presence of food? If there's presence of food, of course it's going to take a while and all of that. Another thing is blood flow to the absorption site. You know, they all still boils down to what route. They all still boils down to what route. For example, drugs that you are giving IV, of course, it's going to be fast. So these are the factors, and this is not just this is the factors are not limited to this alone. There are other factors, but these are common factors that affect absorption of drug. So quickly, let's go into distribution of drug. He said the transportation of blood from the bloodstream to the various tissue of target where the drug is going to act. That is what the distribution means. Okay, you are giving this drug intravenously from the cannula site, right? You are giving it, maybe you are using the veins around your radial area. You are giving it, but it's going to get distributed. Maybe what is strong is actually probably something that has to do with the liver or something like that. Maybe it's something that has to do with the liver. The distribution is from that bloodstream, from that site of injection to where the drug is going to act. That is simply what it means by distribution. All right, so the transport of drugs from the bloodstream to various tissue and organ. Influencing factors include lipid solubility and protein binding. I, like these two things, can they bind to can they bind can everybody hear me, please? Can you hear me? Can you see
Yes,
my
you
screen?
can hear.
Yes, we can hear you, sir. We can see your
Yes,
screen
sir, we
too.
can hear you. And we are seeing your screen, sir.
Okay, sorry. All right, thank you. Um, Sorry. Yeah. Can you sorry, let's continue. I just got a little bit of distraction. Some messages are entering sometimes, so sorry about that. All right, so distribution. That is the drug, the various places where you give the drugs to, from that place where you gave the drug to the target organ. That is what it means by distribution. And factors that will affect it is the lipid solubility and protein binding. For example, we've talked about mechanism of movement in the body. If these drugs can bind very well to protein carriers, it's going to be faster. It's going to be faster. If they can bind to proteins, it's going to be faster because it's an action potential. Now, another thing is blood-brain barrier and placenta barriers, BBB. This is also common. For example, there are some drugs that cannot cross the blood-brain barrier. They can't cross. So if you are giving those kind of drugs, it's going to take time, or it's going to take time for them to reach their target organ. Or for example, if you are giving a drug and you are targeting probably babies or all of those things, placenta barrier, it's going to take time, or it might not even end up getting there or something like that. So these are factors that affect distribution. Another thing is volume of distribution, which
Amakwa
determine.
mikitemeni munyo.
Oh, please mute your mic, please. Which
I'm reading.
determine.
Mem kitere ya dana chomo ofie mi.
Can you just everybody? Can you kindly mute your mic, please? All right. So volume of distribution, which determine the extent of drug dispersion. Like the more the volume, the faster. Just like that. So another thing is metabolism. That is biotransformation, how the body converts those drugs, what it converts it to make it get to its target organ, or to take it out of the body, or to put, what does the body convert the drugs to? The conversion of drug into more water soluble compound for easier elimination. Like, it has gotten to its target organ, which is distribution, right? Now the body taking it out of itself, which is metabolism. But what does it convert it into? Of course, you can't take paracetamol and expect that the body takes out paracetamol. It's going to convert it into something else. So it's either converts it into water soluble compounds, or some other things. So primarily it occurs in the liver, of course, through the process, through oxidation, reduction, hydrolysis, and maybe conjugation. It hap- Metabolism happens in the liver. Mark this very point. Mark this very point, and mark this: oxidation, reduction, hydrolysis, and react and conjugation. They are potential questions. Nobody no See, the questions are not going to come by saying where in which organ metabolizes or metabolizes drug. No, it's going to come in form of maybe oxidation, reduction, hydrolysis, or something like that. Those are the mechanisms through which these questions are going to be coming. Although it's good to know that metabolism happens in the liver, though these are like general knowledge as well, but they want something more. All right, so another factor that can influence these are genetic factors like enzyme activity, liver function, and the drug interaction as well. Things that can influence metabolism of drugs, genetic like genetic factors like enzymes, and the drug interaction with other drugs, or with body enzyme, or body components as well. All right, so number 4 is excretion, the removal of drugs and its metabolites from the body, mainly through the kidney. It occurs through the kidney, through the liver, through the lungs, and sweat or feces. So it can either be excreted through your urine, through bile, through exhalation, like gases, and through sweat, or it can be excreted from the feces. Like we said, during metabolism, it is converted into something different from what the drugs used to look like. So renal excretion depends on glomerular filtrate, tubular reabsorption, and active secretion. When we get to like renal system, we're going to talk about this more. Of course, which we know that you've already done all of this as well. So because this is a post basic nursing. So quickly, let's talk about let's answer this question really. There's a question I spotted, and I said we'll quickly answer it before we move forward. You just pop your answer into the chat quickly. Quickly, you pop your answer into the chat. Okay, so um, these two questions. Which condition may lead to a decreased response to a standard drug dose? And which food, which food should be avoided when taking offering? So quickly, just pop it into the chat quickly. Quickly. Quickly, pop into the chat so that we can continue. Are we doing so? Please pop it into the chat. Let us so that we can continue. Pop it into the chat. Daily, please, how is the chat? Are they? Is anybody answering this chat at all?
Just one person has responded, and I think
Oh,
they're having issues with the visibility. I think you need to zoom in a little bit.
oh, okay. I'll zoom in now. Thank you. Yeah. Can you see the? Can you see the chat now? I mean, can you see the question now? This is one of the question. Yeah. Yeah. Okay. And then I'll bold it so that everybody can appreciate it more. All right. So maybe we should continue then. Somebody say please, anything you want to see, please. Oh, somebody is outside. They said they can't connect to the lecture. Please, Dele, can you respond to them at the group, the WhatsApp group, please? All right, so let us continue. Let us continue. Let's answer those questions though. Let's answer them. So the answer to this number one, actually, there are so many things. Three things that would determine. That three conditions that may lead to the increase in response. Number one, obesity might, because of the surface area and all of that, but it's not significant. Another thing is liver failure, especially metabolism, just like we said. But the answer is actually chronic alcohol consumption, and this is the rationale down here. It's chronic alcohol condition. Say chronic alcoholism consumption induce liver enzymes, increase drug metabolism, and lead to a reduced therapeutic effect for certain medications. So that's actually, now if you see this kind of question in your exam, it's actually a bit tricky because there are about three answers that are wants to fit. If not for this rationale that was shown here, a lot of people will want to go for liver failure. However, if you see this kind of question without like chronic alcohol consumption, you quickly go for liver failure. All right. So, and this question as well is, you said, which food should be avoided when taking warfarin? Any food that contains any food that is rich in vitamin K, and of course, it's green leafy vegetable. Why? Because warfarin is a blood thinner. Vitamin K, of course, you will know that is help to clot blood. So it's like you are giving a therapeutic dose and you are giving a reversal. I hope we all got that. All right, so let's continue from the chat. What some people say B. Like I said, you see, I said, uh, I said, I said it that you might be quick to go and select what's it called, liver failure. Just analyze your options very well before you go ahead. All right, so let's move to pharmacodynamics. Like I said before, it is very simple. Simple definition is what the drug does to your body. What the drugs does to your body. Number one, there are some theories, there are just two of them mainly though, which is number one, the drug receptor theory and idiosyncrasy reactions. The drug reception theory, it actually talk about the effect that the drugs, does to the receptor sites. We will not. I know we would have talked a little bit about this, in our various pharmacological classes, but the type of receptors reaction that you might get is either it's an agonistic effect, which is, for instance, uh, let's use which neurotransmitter now. Okay, for example, if the effect of um I'm trying to look for a very good example to use for you. Okay, take for instance contractility of the heart and digoxin. On a very good day, the heart is a contracting organ, right? And someone being given digoxin, right? Or other cardiac stimulating drugs like epinephrine, like non-epinephrine as well. What happens is it's going to potentiate the effect of that. It's going to enhance the effect of that, very very organ. It's going to make it beat more. The heart is a pumping organ, but it's going to make it beat more. That is, it enhance its activity. That's what agonist just simply means. Is activate receptors to produce a response, or it's either it shuts it down, which is antagonistic. It blocks the receptor and inhibits its response. Or partial agonist. It doesn't really, make it beat more or something. It produces a weaker response than the full agonist. I hope we just get this. Maybe just take a look at neurotransmitters. You will understand this concept more. Another drug reaction that you get is idiosyncratic response. That is response that is not known. You can't determine. It's not predictable. It just happens. For example, somebody that takes maybe you take paracetamol and get Steven Johnson's syndrome. That is not what the that is not what the effect was meant to
Right
be.
seven, T7.
Gosh. Please, can you
But she
please
people
mute,
not
can you
talk
please
right
mute your
seven.
mic, please?
Hi. But exactly who but can I can when made that one can
Can you please mute your mic, please, everyone? Okay. All right. So idiosyncratic reaction is it is unpredictable. For example, a patient developing severe hemolysis after taking a certain drug due to GCPD enzyme deficiency. Those kind of reactions, they are unpredictable, and that's why they are called idiosyncratic effect. So pharmacodynamics is it produces three, basically two, receptor theories. Is either it's an agonist, antagonist, or a partial agonist, or it is an idiosyncratic effect, which is unpredictable. It does not enhance the action of that particular organ. It does not inhibit the action, or it doesn't weaken it. It just produces something very very different. All right, factors that can affect drug metabolism. This one is like coming back to um like it affects drug both pharmacodynamics and pharmacokinetics. So factors include age, like neonates and the most elderly. Of course, we know that the way they will metabolize drug is different. It's going to be a lot more slower than the way young people would. Another thing is diet. He said food that contains food certain food can enhance or inhibit drug metabolism, e.g. grapefruit juice. It induces cytochrome, this enzyme. I don't want to bite my teeth. All right, so some diet actually can actually inhibit drugs metabolism. So, we should kindly watch out for drug instructions and follow those labels. It is very important. Then occupation. He said exposure to industrial chemical can induce liver enzyme, altering drug metabolism. Like smokers metabolize some drug faster due to enzyme induction. It's like, for example, you want to give smokers propofol and all of that, all those anesthesias. Their dose is usually a little bit more, and the time to which they work is a bit less because they, they metabolize those drugs so fast. Another thing is diseases, liver disease. Just like the question that was popped up before, when we asked that, you know, one of those questions that we ask, a lot of people are very quick to choose liver disease. Of course, you are right. If not for the fact that chronic alcohol consumption was there, that liver disease or liver failure would have been the perfect answer to that question. Another thing is kidney diseases. Of course, it will affect the drug excretion. Cardiac diseases, it will affect distribution because from site of giving of the drugs, when we are talking about pharmacokinetic on here, when we talk about distribution from site of the place where you give the drugs, of course it goes straight to the heart first before it gets pumped to where it's going to be having effect. So cardiac disease as well will affect. So quickly we talk about plasma half-life. This is one aspect that is not often talked so much about too in our schools, but let's quickly talk about it tonight. So what is plasma half-life? It's just defined as the time that it requires for the concentration of a drug in the plasma to be reduced by half. Okay, let me use antibiotics for example. They said antibiotics should be given around the clock, right? So half life is, for example, of um you give 1 gram of, let's say, amoxicillin. By the time it gets, let's say, 1 gram was absorbed by the body, right? Its half life is the time when it becomes 500 milligram in the body. That's its half life. So it is the time to which the concentration of that drug in plasma is reduced by half. So that will determine how frequent you are going to be giving those drugs. That is what determines drugs that you give TID, BD, or once a day. It's those half-life that determines those things. So it determines the dose frequency. Drug drug with short half-life require frequent administration, while long life drugs needs less frequent dosing. There are some drugs that you take once in a day. There are some that you take twice. There are some that you take, like paracetamol is 4 to 6 hours. It has a very short half-life. Example, aspirin, it's even 3 hours. It has a very short half-life. Unlike diazepam, has very long half-life because it's about 20 to 50 hours before it can start going from 50 to 25 to 12.5, then like that before it finishes in the body. So individual difference in drug response. Of course, there's individual difference when it comes to the way we react to drugs and all of that. So there is genetic variations, genetic variation. Genetics generally play a big role in almost everything. It influence how we metabolize our drugs. Some are slow, some are fast, right? Then body weight and composition. Higher fat content can alter drug distribution, affecting the lipid soluble drugs. Then there is tolerance and resistance as well. Chronic use leads to tolerance or resistance. like we gave example of smoke, those alcoholics and all of that. If you are giving them opioid, for example, if you are giving any alcoholics opioid and all of that, they need more doses. They need more dose because their body is already a bit used to. They just need higher doses for them to work. And chronic opioid abuse as well, you can't give them low doses. They need more dose. Then psychological factors as well, placebo effect and patient belief can influence drug response. Of course, it first starts psychologically. Some people, when you just give them like water for injection, they believe that, oh yeah, it's working. So those are the psychological factors that can affect drug response as well. So that brings us to the conclusion of mechanism of action. And quickly we are going to be moving to national drug policy so that we can finish off. All right, national drug policy. This is just to have a read. Like we talked a little bit about it in the first day. Where we talk that national drug policy is just to ensure drug availability, affordability, and safe drug usage, right? And the list of drugs that are essential, the list of drugs that are essential. So the national drug policy is just a framework that was established by the government to ensure the availability, affordability, and proper use of medication. Just like we said it the other time, it's just that we just needed to cover this topic so that we don't leave any topic untouched, because we don't know where questions might be coming. These are the key objective of national drug policy. It's to ensure equitable access to essential medicines, and to promote rational drug use among healthcare provider and the public, so that some areas will not get more drugs and some areas will not get at all. It also to strengthen the pharmacological supply chain, just like what I just explained as well. And to regulate drug quality, safety, and efficiency. If these policies are actually working in our country, Nigeria, at the moment, we will not be having all those fake drugs, because this is their own function, to ensure that the quality of drugs is actually what it should be, and people should take safe drugs. All right, so national health policy. National drug policy, let us just know that it is like an arm of national health policy, right? It is like an arm of national health policy. Let's take it like that. So let's quickly go to essential drug program and unit dispensing system. Essential drug program. The essential drug programs ensure that vital medicines are available at all level of the healthcare system. It follows a WHO model list of essential medicine, which includes drugs that are safe, effective, and affordable. Like we just said the other time, that the main goal is for these people is for the main goal of national policy is just to provide safe drug, and make sure that the drug is available, and make sure that it is affordable. So the core principle of national drug policy is that is selection of essential medicine based on efficiency, safety, and cost effectiveness, and reliable procurement and distribution system, and affordable pricing and finance mechanism, efficient drug use, monitoring and evaluation. Those are their main goal. If you cannot, if all of these things, if it's looking as if it's a bit more, just know that number one, affordability of drugs. Number two, availability of drug. Number three, safety of drug. Number three, number four, it's distribution. That's all. That is all that national drug policy is all about. Then you start talking about the list of those essential drugs: antipyrexia, antihypertensive, um antihypertensive, what's it called, drug use in kidney renal failure, this and that. Those are all essential drugs, antibiotics or anti-infectives, to cover a more broader view. All right, so let's talk about unit dispensing system. The unit dispensing system refers to a method of distributing medicine in a single dose packaging instead of a bulk supply. If you remember when we were, back in like 10, maybe it's still come around at this time, there's counting drug, where when you go to the pharmacy, they will open one big one big box, and they start to count inside ziploc bag. They start to count inside those ziploc bag. No, that is not the aim of the unit dispensing system. They want it to in such a way that every every tablet has its own pack, that you can take those drugs out of those pack by itself. That way they can ensure that there's safety of drug, and drug cannot be mashed up. you know like drugs that are in sachets are better than drugs that you count inside ziploc. That is what this unit dispensing system is all about: safety of drug usage. So the advantage is it reduces medication error. Just like we said before, those ones that are inside sachets, they are better. You can it's very hard for someone to mix them up, because you can still see the label, you can read about the label before you start taking them. Unlike those ones that are they've already counted inside ziploc, most of the time you don't see the name, you just see the color. It's yellow drug, it's white drug, and all of that. But this unit dispensing system helps to reduce medication error. It helps to minimize drug wastage, and it ensure proper use, proper dosage adherence. Let's say those ones in sachet, they will tell you use one in the morning, one in the night. But those ones in ziploc, maybe it's biro or pencil that they used to write stuff on the back, it would have cleaned away, you would have forgotten, and all of that. So those this system help to ensure that all of this that we've mentioned are adhered to. So let's talk about the role of nurses in the essential drug program. What are our roles? Number one is dispensing and administration. We've talked about drug administration yesterday. It is not enough that somebody has to prescribe it. If prescription is wrong, the fact that we nurses give it, if anything happen, we are going to be held accountable as well. So dispensing and administration, proper administrating medication and ensuring patient compliance. Properly administering medications and ensuring patient compliance properly. Is it tablet, is it IV, is it sublingual? For example, drugs that are sublingual, if you tell somebody to go and chew it, you know you are going to get a very fast reaction, and which can be a bit more detrimental to the person. Another role of nursing is patient education. What is the drug used for? What are the side effects? What are the things that they need to adhere to? Maybe use it before you eat. I can remember yesterday, Bamidele talking about some slowly released drugs that you shouldn't chew them, or some drugs that you should, like the levothyroxine, that you should use before food. You should use before food and all of that. So for patient education, these are what the nurses takes as a role in this program. Monitoring drug reaction, reporting adverse drug reaction and medication error, of course, and stock management, of course. That the importance of that can never be overemphasized. Nurses are managers. And advocating rational drug usage. you know some people should not get should not get more than some areas, and there should be prevention of self medication as well, and there should be prevention of drug abuse as well. So those are the roles that nurses play. Drug over prescriptions and rational drug use. Drug over prescription occur when the healthcare provider prescribe excessive or unnecessary medication, leading to increased healthcare costs, higher risks of adverse drug reaction, and antibiotic resistance. So many times, before you know antibiotics, These are this program actually help to prevent some of these things. Uh, it's looking a bit boring, right? Because these are policies. Well, we'll be getting more into the pharmacological medication, I think, on Monday as well. But these topics are very important for us to also, do as well. So, yeah, let's talk about this revolving fund as well. It's also common. It's also a common area where questions comes out as well. The drug revolving fund is a financing mechanism where revenue generated from drug sales is invested to maintain a sustainable drug supply. Like whatever money that you generate from there, you reinvest it to keep your stock going, to make sure that the essential drugs are, available. You don't eat your profit basically. So one of the benefits is it ensure continuation of supplies, and it reduces dependency on external funding as well. It also ensure that healthcare system is sustainable. You know, these are things that we don't really see much in our system because of some negligence from malpractice and all of that. Some people don't, they are not accountable. But on the very good day, money that are generated from this kind of policies, from this kind of, should be, recycled back to the system so that we can have adequate and continuous supply of drugs. So there is real recovery system as well. The real recovery system refer to the financial model that ensure funds from drug sales are efficiently reinvested into procurement, maintaining a self-sustaining supply chain. Just like what we have said before, whatever it is that we make, we put it back on, whatever money that has been made, put back, so that there will be continued supply of drugs. Regulation of prescription and dispensing drugs. Government authority implement regulation measures to ensure the safe and ethical prescription and dispensing of medication. Like we said yesterday, uh, medication prescription has gone a little bit more than just doctors alone. There's some other professionals like nurse prescribers and all of that too, that can also go ahead to prescribe drugs. So regulatory aspect, licensing of prescriber and pharmacists, standard treatment guides, pharmacovigilance. We'll still talk about pharmacovigilance later. Control of narcotic and psychotropic substances, and public awareness and campaign. Basically, these are just regulatory aspects that we will need to talk about tonight. And voila, that's the end of of the lecture. Conclusion: national drug policy is essential for ensuring the availability, affordability, and rational use of medicine. The essential drug program and unit dispensing system improve health care access and safety. Nurses play a vital role in drug administration, patient education, and monitoring drug use. Addressing drug over-prescription and promoting rational drug use can ensure treatment outcome and prevent drug resistance. Sustainability model Sustainable models like the drug revolving fund ensure a consistent medicine supply, while strict regulation measures help maintain drug safety and efficiency. So in this to wrap up, take home from this national drug policy is that drug policy is all about availability of drug, affordability of drug safety as well. Then we talk about dispensary system, just to make sure that drugs is safe and there's minimization of wastage. instead of using the counting method, which prone people to mistake. You use those sachets and a single dispensary method. And there's also, there's also the role of nurses in this, like patient education, like keeping of record, like advocating for the rational drug use as well. And there's also the place of regulation, where the authorities, government body, authorize and monitor people that prescribes drug, basically. So that brings us to the end of today's lecture. If there's any question, please let us ask. It's been a little bit long, boring, especially the second aspect because of its nature, but it's okay. All right. So if there's any question, please. Is there any question before we go ahead and call it a day? Is there any question before we call it a day?
Hello, hello,
Hello, sir.
hello. Good evening.
Good evening, sir.
Uh, Still appreciating your effort. I think I have some observation, but I will private chat you with those with my observations.
All right,
It's
sir.
just that I was busy throughout the day. If not, I would have even forwarded the observation. But a quick one. I think we are having challenge with the audio coming from your side.
Okay.
The audio is skipping.
Oh,
So, but I have other observations, suggesting by the grace of God, I will probably chat you later.
all right, sir.
So I'm still outside. I just try to, as you can see, you feel here on the background, you see noise of vehicles moving. But I'm following. So I want to sincerely thank you and your crew and your team for this.
Thank
I'll
you.
probably chat you with observations.
All right, sir. Thank you very much, sir.
Thank you.
Yes, sir.
No, yeah, thank you.
All right. So, in the absence of no question, please, we have some practice question as well on the app that can help. Like I said, this is like it's like a theoretical base lecture this evening, especially the national drug policy. But questions and answer will actually help. It will help a long. It will do a very big deal to helping to solve. For you to know what you are supposed to know and what you are not supposed to know. I hope we have a night rest, and I will see ourselves on Monday. Thank you very much, and good night.